Hello, my name is Justin Reinhard, and my project is a new treatment option for congenital heart defects, phase 2. In the United States alone, 1 in every 100 infants is born with a congenital heart defect or a CHD. Congenital heart defects are birth defects in the heart that arise when the heart is underdeveloped or experiences a malformation in the womb. CHDs can vary from a small hole in the septum to completely missing anatomical structures. Around 25% of patients with CHDs experience critical CHDs, which can be life-threatening and often require surgery within the first year of life. There are at least 18 recognized congenital heart defects, but the two of them that applied in my project are pulmonary atresia and truncus arteriosus. Pulmonary atresia occurs when the pulmonary valve develops abnormally and may seal off the pulmonary artery. This means that the blood cannot receive the oxygen it requires, whereas truncus arteriosus occurs in infants with a shared aorta and pulmonary artery, which is known as the truncus. The condition is very serious since 85% of infants with the condition would die if left untreated. The CHD can cause congestive heart failure due to an overflow of blood in the lungs. One thing that these specific congenital heart defects have in common is that they can be treated with a valved conduit. A majority of the time, a right ventricular outflow tract reconstruction, RVOT, can treat these conditions. The surgery restores proper blood flow to the lungs by connecting a hollow valve tube known as a valved conduit to the right ventricle and the pulmonary artery. The surgery has been proven to be very successful. For truncus arteriosus specifically, the surgery has a 90% success rate. The conduits themselves are very useful, but are causing problems for some patients. The valved conduits can be made from bovine and human tissue, as well as Dacron or Gore-Tex. However, some studies have shown that the biological tissues may be causing infants with CHDs to become even sicker. Bovine jugular vein grafts are one of the most commonly used conduits. They are harvested from cattle and make exceptional conduits. Children with these conduits, however, are at a higher risk for developing bacterial endocarditis, which is an inflammation of the heart. In one study of 245 patients with bovine jugular vein graft, 6% of patients developed endocarditis with a median follow-up of 7 years. It is estimated that 17% of patients would develop endocarditis within 10 years of the conduit's placement. It isn't entirely clear as to why this is happening. Some theories blame late tissue degeneration and bacterial adherence. This could mean that the bovine and human tissue begins to die before placement of the conduit. In this example here, this is a normal heart in which the blood comes in through the vena cava, down through the right atrium and right ventricle, and then through here where it goes to the lungs. In the example of pulmonary atresia, it comes in through here, but then it is not able to go to the lungs because it is being blocked by the sealed pulmonary valve. So instead it sneaks through with the septal defect and can either go through the aorta or back into the lungs where it may receive some oxygen. But this is why it's so life-threatening, because it is hard for blood to go to the lungs. My questions are, can I create an alternative valve conduit? What will I use in order to make it? And what will its efficiency rate be? My hypothesis is that I believe I can create an alternative valve conduit that utilizes rubber silicone, and it will have an efficiency rate of at least 99%. The materials that I used include a Sharpie, a ruler, a pair of scissors, a sheet of neoprene rubber, a metal ring made of brass, translucent silicone adhesive RTV 108 from Momentive, and a Craftsman shot vacuum. Before I talk about the design that I ended up using, I was going to talk about the one that I originally planned on. Before determining the final model for my project, I was originally going to utilize 3D printing. Using my school's 3D printer, I printed off a mold. This mold would fit together like a puzzle piece, and after putting the pieces together, I would pour liquid rubber silicone into the mold. After hardening, I would take off the mold and test. The reason I did not stick with this plan, however, is because it was hard to print out the smaller pieces, and the pieces were hard to get to fit properly. To start my procedure and testing, I started by making it my valve conduit. Using scissors, I cut out an 8 centimeter by 10 centimeter piece of neoprene rubber. This piece is used as the conduit portion and will contain the valve. After cutting out the piece, I placed my metal ring inside of the piece of rubber silicone and wrapped the silicone around the ring, noting the measurements that allow for the ring to fit snugly in the conduit portion. I then removed the ring and wrapped the conduit portion to the noted measurements that were marked with the ring inside. I placed the translucent silicone adhesive under the overlapping portion of silicone. To allow the silicone to set, I let it sit out for 24 hours. Once I completed the conduit portion, I began the valve portion. Placing the metal ring on the neoprene rubber, I took its measurements so that it fits in the ring perfectly. I then cut out the rubber with the ring's measurements, placed the ring inside so it fit comfortably. I then applied the silicone adhesive to the sides of the ring so that it wouldn't move around inside of the conduit. After letting the adhesive set for 24 hours in the conduit, I applied the adhesive to one small area of the ring. Finally, I pushed the cutout piece of the rubber on the adhesive on the ring so that it covers the ring's hole, and this would act as the valve's cusp. I also want to explain why I use the materials that I did. There are many significant benefits to the use of rubber silicone. It is waterproof, long-lasting, light and flexible, non-biological, and easily customizable. The main benefit here is that it is non-biological, since biological conduits have been linked to higher instances of bacterial endocarditis. The silicone adhesive prevents separation of the different pieces of the conduit and holds the pieces together. The next step was to test my valve conduit's efficiency rate, and the efficiency rate demonstrates how well it would perform inside of the body. I began by taking a shot vacuum and making it so that it expelled air. This represents when the bloodstream is coming through the valve. The valve needs to be open during this process so that blood can properly move throughout the heart and body. Securing the valve conduit, I placed the vacuum up to the opening of the conduit and observed if the valve opened or closed. After seeing if the valve opened or closed, I made note of it. I repeated this process 200 times. I then tested the valve's ability to close. When blood is pushed backward in the valve, it needs to close. Securing the valve conduit, I set the vacuum so that it drew in air. I observed if the valves opened or closed, or to see what happened. And after observing if the valve opened or closed, I made note of it, and I repeated this process 200 times. And here's an image of what my conduit looked like. Here is the cusp portion up on the top left. And then here's the metal ring that went inside. And this is the cylindrical conduit portion. And there's the silicone adhesive that's holding it together. And this is when all three pieces are inside. So the ring is right about here. As you can see, there's a little bump right there. And that's where the ring is. And then the black portion is where the cusp is. And when air comes through the conduit, the valve should open and the cusp would come this way so that it allows the air or liquid or whatever's passing through it to move properly. Out of 200 times, my valve conduit opened properly 200 times. This gives it an opening efficiency rate of 100%. Out of 200 times, my valve conduit closed properly 200 times. This gives it a closing efficiency rate of 100%. These results show that the valve would most likely move easily in the body. During my testing, the device remained structurally sound, meaning it wouldn't fall apart or break if used in the body. So here are my charts. As you can see, this is the efficiency rate of the opening portion of my valve, and in each set of 10 that I did, it opened properly 20 times. It did not close at all. It opened up every single time perfectly. And then over here with the closing efficiency rate, it did not open when it wasn't supposed to at all during the closing portion, and it opened every single time, meaning that it had 100% efficiency rate. And there's another chart to help represent it. And there's the closing efficiency one too. So I also wanted to do a t-test, and a t-test is used to determine if the data happened by chance. I performed a t-test for both my opening and closing efficiency rates, and I got a p-value of 0 for both. Also, to get these results, I use a two-tailed distribution in type 1, which is a paired test. My results from the t-test mean that my data is exactly equal to the null hypothesis and implies that my data was not random at all. In conclusion, my hypothesis was supported. The valve conduit made out of rubber or silicone had an efficiency rate of 100%, which is greater than 99%. I expected to see these results since I learned a lot about what goes into making a valve in my project last year. And these results also indicate that my valve's efficiency could keep up with those used currently. My results, however, do not indicate whether or not my valve would have more or fewer rates of endocarditis. My project applies to those suffering from congenital heart defects and to researchers and doctors who are studying to better solutions to CHDs. By doing more research on valved conduits and other treatments for CHDs, we can better treat patients and achieve better outcomes and hopefully decrease the rates of endocarditis in patients that require valve conduits. For future work, I would hope to test the rate of bacterial growth with the use of rubber silicone valve conduit. By testing this, I would compare the risks of bacterial endocarditis with that of the bovine jugular vein graft. And I would also like to test the susceptibility to thrombosis. And I would also be open to the fact of 3D printing my model, but with a silicone 3D printer rather than a plastic one, making the mold, then pouring it in. I'd rather just use the silicone 3D printer and just do it once so I don't have to work with the small pieces. And here's my bibliography, slide 1. Second slide. Just kidding, there's only one slide. Okay. Once again, my name is Justin Reinhard, and my project is a new treatment option for congenital heart defects phase 2. Thank you.